right? Diversity is much more than just color of skin, where you were born, languages you speak. It's skills, traits, experiences, just life experiences. Ask Dr. Gray pre-med. Oh, hey. All right, hold on. You shh. Ask Dr. Gray pre-med Q&A brought to you by Blueprint MCAT. How are you today?
I'm doing well. How are you, Dr. Gray?
I am great. What can I help you with?
I have a question about my situation with the application. I have ADHD. I was diagnosed with it for a while. I never got accommodation, so I kind of did a little bad on my undergrad and really throughout my educational career.
Mm-hmm.
And then when I started being more informed about it and getting the care I need, I started doing really well, and it shows.
Okay.
Now my question is, should I disclose, since it's like a main thing that affected my performance, should I disclose that to medical schools? I'm just a little afraid that there's like a little bit of a stigma around it. Oh, this person might not do as well in our program because of this.
Yep.
So I'm in between. Should I share it so that they know, oh, okay, I figured it out and I'm good now? Or,
yeah, that's the question. Ultimately, that's the hardest question. One of the hardest questions out there is disclosing a potential red flag to schools. So the question that I come down to is, number one, has this diagnosis, treatment of, journey with, has this impacted your decision to be a physician?
It wasn't the seed that kind of led me to explore the field and get into it, but it definitely has an impact as someone who is a patient of something that is long-term that you have to live with.
Of course.
I know that side, and it kind of motivates me to be able to be that person that can give back to those patients that I was once, or that I will always be.
Okay.
If that makes sense.
Yeah, it makes complete sense. So it's not a core reason why you want to be a physician. So we don't need to include it there. That's usually my first big decision point, is if it's a big reason why you want to be a physician, then you probably will have to include it to tell your story about why you want to be a doctor, knowing your concern that there may be some bias out there. There may be some prejudice out there against students with ADHD or whatever the students have, whatever they're going through. So if we don't need to include it for that reason, then the next question is, why do you think you need to include it as an explanation for poor grades anywhere other than potentially secondary questions that ask, hey, if you have poor grades, let me know why?
Because my poor grades aren't just a set of poor grades. It's a pattern. It was just throughout all 4 years of undergrad, just clear lack of I didn't show that I am capable of handling any kind of rigorous coursework. I had a 2.9 GPA.
Correct.
And then it's a drastic change from there. It's like, I'm sure they're going to ask what happened. I have like a 3.8 in a medical sciences program. So
they may ask.
Okay,
they may ask. You don't know if they'll ask. They may ask. Or they'll go, oh, this student wasn't super focused, and now he was.
I see.
There are a million reasons why someone doesn't do well in undergrad. Most of the time when I talk to students, it's typically because they didn't know they wanted to be a doctor. C's equals degrees, and they're just trying to get through undergrad because they think they need a college degree to go live their life.
Oh, that was also 100% me as well. I'm a career changer on top of that. So
there's your answer. I didn't want to be a doctor then. I was studying whatever you were studying. Wasn't super focused, didn't really care about my grades because it wasn't important.
Okay. Yeah, that makes me comfortable. I think I can go off of that. So that answers my first question. But we also have a segue. Speaking of me being a career changer, that segues into another question that I have for you. As a career changer, after I graduated my first undergrad, I went out into the professional workforce. I worked, I got married, I bought a house, all of these, adulting quote unquote things that one would do. And I believe that I was also an entrepreneur, so I believe that gives me a lot of experience that I've seen can help already in like the master's program I'm in, and how I can what I can offer to my classmates and stuff. But it's hard for me to articulate it. Like I can't really wrap my like head around it. Like how do you explain that? Oh, just because I bought a house and went through that process and pay mortgages and have all these responsibilities, I'm suddenly like a better candidate. I don't know how to like explain that without sounding arrogant.
Yeah, you don't, because you will sound arrogant. I think you try to find the specifics in that, right? What was it? And probably home ownership, probably not the best example, right? Oh, it taught me responsibility. What like that's less important. Entrepreneurship, there's some potential tangible skills there. So you have to look at your life and go, what skills, what traits, what experiences do I have that I think I can add to the educational environment of my classmates? And you're thinking about it, which is great. Now the question is just, how can we get super, super specific and go, okay, there's this thing that I went through. I was adulting. I was an entrepreneur. I have a spouse, whatever. What can you tangibly take from that and bring to the class? That's how you have to think about it. Not just in general, I'm a responsible adult who can pay their bills and I have a credit score of 830, therefore you should trust me and I'm going to be a good classmate, right? Very specific, tangible skills, experiences that you want to bring to the class. That's how you should think about it. And it should only come up when asked. So when a secondary specifically asks, like, what diversity can you bring, right? Diversity is much more than just color of skin, where you were born, languages you speak. It's skills, traits, experiences, just life experiences that you can add to the class.
Okay. And that's something that I shouldn't really touch upon in the personal statement.
Nope.
That makes sense. Well, you gave me 30 minutes, but you really were so efficient in finding, almost helping me find the answer to my own questions, which I love. So thank you so much. I really appreciate it, because it was something specifically the ADHD thing. I'm really kind of just worried about that, but
don't be.
A good point about having this.
Yeah, you are not alone with ADHD. Having ADHD will not prevent you from being a great medical student or a great physician or a great resident. It is what it is, and you'll be fine.
Okay. All right. Well, thank you so much, Dr. Gray. I appreciate the time to answer my questions.
So I have a question for you. You're applying. When are you planning on applying?
The next year. So in the next year's cycle.
And when are you taking the MCAT?
In January or February. I haven't really decided yet.
Okay. But, so it's probably won't be February, because they don't offer the test in February typically. So January, March, or April. So earlier is better, gives you some flexibility. If you haven't yet, I want just a quick plug for Blueprint MCAT, our sponsor. Go create a free Blueprint MCAT account if you haven't yet, and get their study planner tool. Start figuring out what your schedule is going to look like with MCAT prep.
Okay, thanks for the tip. I'll check it out.
You're welcome.